Hello, I am Dr. Jessica Whalen. I am a doctorate of nursing practice and psychiatric mental health nurse practitioner. If you haven't met me, I am the co-chair vice president of St. Louis Nurses in Advanced Practice and the owner and CEO of Holon Inclusive Health System and adjunct professor at Maryville University. Happy National Nurse Practitioners Week. The American Academy of Nurse Practitioners has put together an awesome theme. NPs moving forward, today, tomorrow, together. One of the subsets of this theme is COVID-19 may have started this fight, but together we will win it. Today I will be addressing the under-addressed topic of mental health and COVID-19. But before I address mental health and COVID-19, I really want to go back and address the theme for nurses and especially the community with one word: together. We just had elections. And I want to point out that with the elections, we had another example of extreme polarization in this nation. In my opinion, it is highly unnecessary polarization and is also highly institutionalized. Together. Together, we can find solutions. We can find solutions that meet the needs of all people. Nurses do it every day. That is the part of the code of our ethics. And not just nurses, healthcare workers. Healthcare workers in general train to fight implicit bias every day. Implicit bias is the bias we don't mean to have, but it just somewhat arises. It's that accidental bias that comes up. But we fight to come up with creative solutions to achieve the best outcomes for the people around us and our patients. We can do this as a community. Whether we're healthcare workers or we're just a person, a parent, a family member, a friend, or just some person on the street being another person next to another person. That is how we will win every fight. That is how we will win against COVID. That is how we will win politically, and that is how we will win in this nation. You can be very amazed at what kind of solutions you can come up with instead of choosing a fight or a side in an argument. You can give up on a side and instead decide to work on finding a different strategy or solution. I try and do this every day, and you can be amazed at what kind of solutions or new strategies you can come up with when you take this approach. This will be the way that we, quote, win it. Back to the initial topic at hand, mental health, which I do think together and talking about polarization, in my opinion, and working together as community does address mental health. I do want to address some of the statistics on mental health and COVID-19. There is actually some new research that was recently conducted by the University of Oxford, and they have found that nearly 1 person in 5 diagnosed with COVID-19 is diagnosed with a psychiatric disorder like anxiety, depression, or insomnia within 3 months of having COVID-19. People recovering from COVID-19 were about twice as likely to be diagnosed with a mental health disorder as compared to those with the flu, according to Paul Harrison, who is a professor of psychiatry and one of the authors of this study. In addition, patients with mental illness are about 65% more likely to be diagnosed with COVID-19. They're not exactly sure why. Something that we do know in the mental health community is that patients with mental illness are generally more likely to die earlier. They are more likely to have comorbid health conditions. In the past, they have blamed this on the illness itself. They have blamed poor compliance because of their mental health conditions. I think there is some things that are deeper than this. I also believe that there is still the stigma of mental illness. I see this every day with my patients. I have to advocate very hard for my patients to receive adequate medical care. I do believe that the instant that a patient has a mental health condition, that a lot of their medical symptoms start to be ascribed to their mental health condition. Both patients and providers can have an awareness that when a patient comes in and they're saying that they're feeling fatigued or that they're feeling not well, that we must do our due diligence and really work that up medically. We were trained in school to do and rule out medical first. I find it is very easy to start assuming that it might be depression or anxiety, and instead push away the fact that it could be a medical condition. So I always make sure to do the most thorough of medical workups. I also teach my patients how to describe symptoms. Patients did not go to school as long as their healthcare practitioners did, and they don't use right language a lot of times. And so they use language, especially if they have mental health conditions, that sound a lot like the things that they know, which sound like mental health words. And so unfortunately, then their other providers start saying, oh, that sounds like your depression, when really it may be something that more likely would fit a medical condition. So this is something that crossover is important, especially because inflammation is sneaky. Inflammation, whether it's a virus, inflammation, whether it's autoimmune, our body is interrelated. My company that I started is about holistic health. I think most nurses, and we can agree, are about holistic medicine and a whole body approach. It's built into our curriculum starting as an RN. And inflammation plays a role on our brain, and it plays a role in every body system. It's important to continue to recognize this all the way through. I think that patients who are struggling with mental health are struggling with mental health, and that these viruses are triggering their conditions to present more. The reason they're getting diagnosed more and the reason we're seeing a spike, this happens all the time. And there is a term for this. It's actually one of my special interests, epigenetics. When you start to, everybody's got predispositions to something. And as you start to turn stress on, it starts to turn our genes a certain way, and it only takes a certain amount of stress, and everybody's got a threshold. I don't know what that threshold is, but everyone's got a threshold. And I can't look at you to tell you what your threshold is going to be, but under some certain stress level, that threshold is going to turn your genetics a certain way. And if you're predisposed to anxiety, the anxiety will turn on. If you're predisposed to depression, the depression will turn on. If you're predisposed to bipolar disorder, the bipolar disorder will turn on. So under that stress, and COVID-19 could be a stress, and it could be that right stress that triggers that illness to start to come out more. And it could inflame the condition. Epigenetics is the study of this. And there are all kinds of other environmental triggers. But that is something that I do believe creates that rise. And the longer the trauma, the longer the stress, the worse it can get, and the more it can snowball for patients. That is why it is very important to have preventative health care. And that is why it is important to also continue to treat and to continue to prevent. This is always in motion. In addition, the risk of anxiety disorders, they found is not in general not causing everyone to cause anxiety. Although there's a lot of social media saying that everyone is experiencing anxiety, there's kind of a misnomer. Anxiety is the number one symptom that every person feels. We have a fight or flight response. So yes, we're supposed to feel anxiety. Is it clinical to where you need to seek help? That is different. Everyone experiences anxiety, but if it's starting to impact your life and ability to function, your ability to do work, your ability to concentrate, your ability to socialize, or your friendships, if it's impacting life in a negative way, then you would want to talk to your practitioner. But everybody does experience anxiety. It's actually a protective mechanism that we're supposed to have to help tell us there's danger. So that's why that term can get thrown around very loosely. And that's why it's very important that testing is done to make sure that one is diagnosed properly if they actually have, quote, anxiety. We are going to see an increased rise because of what I talked about with epigenetics. We're going to see an increased rise of people that are predisposed to anxiety disorders because there is fear, there is sadness, and there is isolation. So those patients that are now being exposed to that more than ever, epigenetically, are likely to struggle with conditions that they may have been predisposed to. They may have insomnia issues. Post-COVID patients, especially that may have been predisposed, there's a lot of reports that providers are talking about with patients having distressing dreams. They're waking up. They're feeling like they're back in the hospital after they had the illness. So we are also having patients with some post-COVID PTSD. Actually, if it hasn't been 6 months, you can't really call it PTSD. You would call it an adjustment disorder. So they are having some anxiety, some intrusive thoughts about having been in the hospital or having been treated. They may not be sleeping well. They may need to see a practitioner about this because of intense anxiety post-treatment with COVID. The sooner we treat it, the better, because long-term, this could actually turn into a post-traumatic disorder. We see this all the time with patients who have had traumatic illnesses, especially with patients who have been on ventilators. We want to watch for those patients who had hypoxia for long periods of times because they may actually have brain injury as well. There's also some great information that was put out by the World Health Organization on global mental health and COVID-19. I always like to follow World Health information because it's not just looking at the United States, but it also looks at what is going on globally. To me, how do you know how to get better if you don't compare what others do and what we can improve on or what we may be doing well? It's one of those things about finding creative solutions. So the World Health Organizations found that using a survey on mental health and neurological and substance use services in 130 WHO member states, they revealed that most countries are experiencing some disruptions to mental health services. And the greatest impact in these services are on the community-based prevention and promotion services. And that to me is my heart and passion. They found that the reason for the disruption of these services include an insufficient number of redeployment of healthcare workers to the COVID-19 response in 30% of their countries that are part of this. They also found that in many countries, well, in 19%, so that's those aren't many, but 19%, it's not the majority, but 19% of the country's mental health facilities have been converted into COVID-19 quarantine or COVID-19 treatment facilities. I know in the United States in particular, and this isn't a COVID-19 problem, we historically have not had enough mental health beds. We are actually underserved with mental health populations. We do not have enough mental health providers, period. This has been an ongoing crisis coming from being in mental health myself. We also have had in 28% of countries insufficient supply of personal protective equipment. I do want to stop on that for a second because this is to the general public. This is one of those public awareness things, and I have to point this out because in the hospitals as nurses, we understand that personal protective equipment is not all about you. Personal protective equipment does protect us from getting icky bugs on us. However, the bigger reason for personal protective equipment is to keep us from taking bug from room to room to room to room. This is the real reason for personal protective equipment. So, for those of you out there that did not want to mask, because it's okay, I'm not immunocompromised, or I can fight this off, or I'm going to take supplements, or this is all a hoax. It's not about you. And the person next to you may not know if they're immunocompromised. You can't look at someone and know if they are. It is about prevention, which we just saw, according to the World Health Organization, is one of the areas of largest struggle in general across the globe. Not just the United States, everywhere. Transmission and prevention of transmission is what we're trying to accomplish. Ego's down. It's not about you. Yes, I want you to be safe as a person. I want everybody to be safe. It was about preventing spread from room to room. Nurses understand it. I don't think we did a good job training. I'm sorry we didn't do a good job training. Actually, by keeping people out of the hospitals, they didn't see what the nurses saw. They didn't see the sea of yellow rooms. If people had had to see the sea of precautions, we may have had a different story if they had had to walk in and see all the people that have been infected. But we sheltered people. And so there were a lot of people that thought this was a hoax. Well, it's not a hoax. And a lot of people have been sick. Some people weren't so sick and some people only got minor symptoms. This is the nature of a virus. But some people got very sick and some people died. A lot of people died. Our job is to try and prevent that the best that we can. And one of our best tools for that is protective equipment. So we can still do this and we can still use our protective equipment. And that is my public safety announcement. 116 countries, which is 89%, reported that mental health and psychological support was part of their COVID-19 response plan. But 17% said that they had funding for this. So although all of them had big plans, only a tiny amount of them actually got money for this. That seems to be usually where mental health stands. I have seen this time and time again. Usually mental health is the low man on the totem pole for funding. I remember when I was a new nurse and I was at the big fancy top 10 hospital in the nation, and we got all the old equipment and the cardiothoracic unit had all the fancy newfangled, all the new fancy stuff and all the new things, and we got the 10, 15-year-old stuff that was falling apart. It was grand. So We have a long way to go in mental health still and making sure that there's proper funding. I would like to see more of that. And as a community and awareness, I think we can do more. Historical examples have shown that mental health and viruses and pandemics go hand in hand. The Ebola virus is a great example of this because there was also widespread panic and anxiety and depression when there was the Ebola virus. There was also stigma and social exclusion of the survivors that had dealt with the Ebola virus. We also found that with the Middle East respiratory syndrome that occurred, there were 33 to 42% of patients that were struggling with depressed mood, anxiety, and impaired memory. I actually see this a lot with patients that have respiratory impairment conditions, whether it's COPD or asthma. There is a lot of difficulty with memory. There's a lot of difficulty with panic attacks. It's air hunger. Your brain needs oxygen to survive, to think. So that is why we teach deep breathing in mental health, is to get more oxygen to the brain. And that is why it is so important to get the right medications to treat these lung conditions and to train our patients about that as well. In addition, COVID-19, some of the things that were interventions that were put in place to halt the transmission probably impacted more mental health issues that we saw. And these were school closures. I understand this was necessary, so I'm not saying that we shouldn't have closed schools, but in our children, watching and monitoring them for more depression and anxiety is important. I saw this with my own child. So we're a family of Aspies. So my oldest was definitely struggling more with his social skills. He started back in school. They're doing very well, and they're doing their social distancing and all of their techniques. But monitoring our kids now that they're going back in, watching for that anxiety, screening. A lot of them had social anxiety, and now that they're getting back into that transition, it's another adjustment phase. Helping them through this adjustment phase is very important. There were a lot of job losses during COVID-19. A lot of people are in financial distress. Helping them through this time as well is exceptionally important through a transition. Food hunger, food loss, and in areas where food access is hard, we should be also asking patients about their ability to access food and if they're getting their needs met in that way, and if they need any assistance. Many people are very shy about bringing these kinds of personal things forward, even to their practitioners. We have seen a lot of substance use on the rise, a lot more overdoses. My counterparts in substance use, where they were feeling they were having some wins, are seeing setbacks again. People with anxiety and mood are turning back to substances. Some of this also is having difficulty accessing treatment. They're having trouble getting into their psych providers again. Maybe it's because telemed, maybe it's because increased visit load on their psych provider behalf. And so they can't get their visits, they can't get their meds, and so they're turning back towards street drugs, or it's just stress. Where all of these factors are playing a role, and so we're seeing an increase in overdose again. We are also wondering if COVID-19 itself as a virus has direct neurological consequences. This is being studied as we speak. We don't have all that evidence yet, but we do know that some viruses actually change DNA. This is going to be continued to be studied, and I'm sure we'll have more emerging data as it goes on. People with salary jobs were less likely to be affected than those with informal daily wage jobs, um, which included a substantial proportion of the workforce in lower income countries. So, kind of watching for those populations with the ones that were struggling financially. A lot of our patients in the mental health space generally are the ones that are those daily wage jobs. And so many of them kind of went back to struggling with being without work. Many of them were struggling with getting, again, access to services and finding a way to get in with their provider, which has, again, exacerbated symptoms of their conditions. As for our good frontline workers, my nurses, my health staff, they have been flooded, inundated. Beyond just dealing with COVID-19 itself and a virus and heavy, heavy loads of numbers, they're dealing with this backlash of mental health and patients and the comorbid symptoms that are dealing with other health conditions exacerbated by a virus. Anytime you have a pandemic, it plays a role on other health conditions. It also backlogs people from being able to get in to treat their other health conditions. When you backlog a system because of a pandemic, now your patients who have chronic health conditions like diabetes can't get in for their diabetes. Now you have patients with chronic mental health conditions that can't get in easily to manage these conditions. Now we have a lot of patients who have put their needs on the back burner and they're sicker, and they were already very sick and needed regular routine care. Now they're super sick, and we were already dealing with very sick patients with COVID-19. We talk about burnout already, and our nurses and our frontline staff being burnt out. We talk about their salaries already being cut. We talk about them being excessive work hours. We talk about excessive crew. Mandated overtime happens. It happens frequently. There's more violence than ever on the floors, and frequently under-supported by administration. I have been in these roles. I have been in these positions with where I've been under-supported by the administration, and I have seen the salary cuts. I have seen the poor staffing ratios, and frontline workers, they have to endure. They are dealing with the sickest patients. It is like being on a war zone because the acuity is high. And even if you're in an outpatient office, there are so many layers. So even though I'm not in the hospital, I'm considered frontline dealing with my patients every day, and the acuity keeps going up. And we have insurance to deal with, and we have more paperwork to deal with, and we have more phone calls, and we have more regulation, and it keeps adding and adding and adding, and there's little reprieve for the frontline worker, whether it's a nurse, whether it's a doctor, whether it's a paramedic. All the healthcare workers are experiencing increased workload, increased trauma, and they are even more susceptible to stress and burnout and depression and PTSD, more than ever, even substance use disorder. I'm a huge advocate, and I didn't mention it above, but I am the Missouri president of Nurses Against Violence Unite, and even though it says nurses in the title, it's actually for all healthcare workers, because one of the things we see is that there's not really a place to turn. In some areas of the country, you can even, if you even give a whiff that you have a substance use disorder as a nurse, your license will be stripped from you. There's no place to turn, and people are terrified to ask for help. There is a double standard for treatment on our frontline workers who may be struggling with the same mental illnesses. And we need to find ways to help our frontline workers. I work with many nurses and nurse practitioners, as a mental health provider, it's something that I love to do, is working with other professionals and helping them and helping with PTSD. And I see it all the time because our job is hard. We see patients die. We see, and especially right now, there were so many deaths, more than people were ready to deal with. And the violence that has been escalating on the front line. No, we did not go into the job. It is not a job expectation to get hit. And the data does support that actually healthcare workers experience more day-to-day violence in the workplace than police officers. And our police officers, too, are experiencing much violence. And we talked about, political division. We talked about all of these issues that are going on that we can work on. Mental illness hits so many different levels, and we as a community need to help each other. We need to help our healthcare professionals so that our healthcare professionals can continue to help us, because they're helping us at our most vulnerable, when we're feeling at our worst. In addition, mental illness affects a lot of times our abilities to think and process. So sometimes it does affect compliance, and we just need to continue that awareness and continue to educate. So that is one of my huge passion points. I do want to make sure that people know that I like to be a resource, and if anybody wants to reach out through St. Louis Nurses in Advanced Practice to get a hold through the website, they can contact me if they have any questions on mental health, if they have any questions on COVID-19 and how that may affect, if they have any questions on epigenetics or anything like that, or how to get assistance as a healthcare provider that may be experiencing anxiety, or how, if they want to get involved with supporting other healthcare professionals that may be struggling. Because I think if we work all together, we can, just like what we're trying to do with the American Academy of Nurse Practitioners has put together in their theme, today, tomorrow, together. We can, even though COVID-19 started this fight, we can win it. And so that is a lot of information in this amount of time, and I went way over probably what Maria wanted to say, but there's a lot with mental health and a lot tied in that I feel does get understated. So that's why I wanted to go over it all. I do hope you guys have a great afternoon. Oh, I almost forgot. Sorry. Because she did want me to bring up one more topic, and that is social media. And actually, this one is very important. So I will go over that. So social media, and I have gotten stuck on this one too. So social media can be a little bit of a stinky cheeser. I don't know what good word to use for it, but it can be a little nugget. We need to use right speech. It's really easy with social media because you don't see the person on the other end to make those negative comments. It's really easy to try and call someone out, and that's part of this polarization, especially when they have an opposing view or a different mindset. And we saw a lot of that. And that's actually a lot how this institutional polarization, in my opinion, is happening. It's a very easy way, more than ever, to ensure that people stay polarized. In fact, it can make it happen through algorithms and through math. through these systems and through browsers, you can actually ensure that certain information pops up through searches, etc. So, to me, that is why I am so against fighting one side or another. It doesn't create a solution. It doesn't help us work together. It doesn't help us bring down stigma. It doesn't help us win a fight. It doesn't help us be together and make things positive. It doesn't bring together a solution. So in social media, I learned, because I used to get triggered. You can ask. I used to, on Twitter, I'd say about was like, because I'm very politically active, and I've gotten more politically active. I told my students this. I said I didn't want to be, I call it the whiny wheel. I couldn't gripe about anything anymore and not be active. You can sit there and whine and say you don't like something, but not do anything about it. That's silly. If you don't like something, be active. Vote. Get involved. Go to political meetings. You have to be involved. Make a change. Make a difference. Be active. Find creative solutions. That is my answer. So when it comes to social media too, I used to get really triggered. People will come at you, and there are some people that, yes, they love to just get your goat. They intentionally go on there to come at you. That's all they do. They're bots, and they like to get a rise out of you, and they think it's funny. Some people just have no filter on social media because there's no person, there's no emotions that come back. Right speech is important because if we really want to change our mental health and where we're at, and if you're feeling stressed, and if you're feeling anxious, and if you're feeling depressed, it does no good to go online, just like it does no good to go to the person next to you and say, and give them some attitude. There's always the story of the butterfly effect, that there may have been that person that was walking down the street, and you may have smiled at them, and it may have prevented a suicide because you may have been the one person that smiled at them, and they may have felt that they were lonely and that no one noticed them, and because you smiled at them, it prevented them from doing something like committing suicide. It's the same thing online. That one statement could be the tipping point. Epigenetically, it could be the tipping point for suicide. Right speech is important, whether it's online or in person. So I do need to end on that. And I'm glad I didn't forget about it because I think we forget, and it's easy to forget because it's so fast. It's on a phone, it's quick, it's technology. There isn't another person looking at you. But don't forget about that. And if we spread positivity, it's just the same. It can spread like wildfire. Think about it. If you just spread happy, positive vibes, and everyone just starts doing that, it can turn a shift. We can just spread smiles like a butterfly effect. So I throw that out there for you, and I encourage you, even if you're irritable and want to throw irritable, angry memes all the time, just put those happy rainbow memes and see what happens. I hope you guys have a good one. I will see you soon. Bye.